Hello, and welcome to our First 1001 Days lunchtime webinar on supporting dads. It's great to see some familiar names joining and some new ones as well. And so whilst people are still joining, I thought I'd just introduce myself for those of you who don't know me. So I'm Ben Curran. I'm campaign manager at the Parent Infant Foundation. And through that role, I'm organizer of the First 1001 Days movement. Our movement's an alliance of over 200 charities and professionals campaigning to raise awareness and drive change for babies and their families. We run these webinars to give our members a platform to share their expertise and best practice, and so we can all learn together. And so the theme of today's webinar is supporting dads, and we've got two excellent speakers for you. Unfortunately, due to illness, Jessema from the Fatherhood Institute isn't able to join us, but we do have Jeremy Davies from the Fatherhood Institute stepping in her place to talk about their Looking Out for Dad campaign, before Kieran Anders from Dads Matters and Homestart talks about the excellent work they've been doing on the ground in Stockport. As always, there will be scope for you to ask your questions, so please submit them at any point. Jeremy will be the first speaker, and we'll take some questions for him straight after his presentation because he needs to get off, and then Kieran will present and we can take questions from Kieran after that. Before I pass over to our speakers, I just want to let you know about what's happening for Infant Mental Health Awareness Week, which is quickly coming up to us. So Infant Mental Health Awareness Week starts on the 9th of June and runs through the 15th. I think there's two things really that I would like to highlight to you that I think might be of interest. The first is that there will be a webinar on the launch of Holding the Baby, the report, which will feature speakers from the Parent Infant Foundation, who are the authors of the report, but also Maya Ellis MP, who's the chair of the All-Party Parliamentary Group on Babies, will give sort of a policy perspective on the question of who's holding the baby. And the other thing that we're asking is that for you to invite your local MP to visit a service if you work for one. We've put together a visit guide with a draft email, sample agenda, and other tips for hosting a successful event. And you can book onto the webinar or download the MP visit guide through the Infant Mental Health Awareness Week website, which is at parentinfantfoundation.org.uk/IMHAW. So without further ado, I'll come back to our speakers and I'll pass over to Jeremy.
Thanks very much, Ben, and it's great to be here. Now, let me see if I can share my slides. Okay, I'm hoping that you can see that. Is that working?
Yes, that's fine, Jeremy.
Yeah, okay, great. So, so I'm not Jessema, as Ben explained. I'm Jeremy. I'm the Deputy CEO at the Fatherhood Institute. And I'm here to talk about our Looking Out for Dad campaign. So I guess the overall story is that dads today are much more hands-on than ever. They're changing nappies, they're doing school runs, they're going to health appointments, and they're there fundamentally for their children. But while that has shifted significantly over recent decades, health services haven't really kept up with that. And so men's health is often treated and thought about separately from their fatherhood, if it's acknowledged at all. So what we want to do through this campaign is to change that. So to be the dads that we want men to be, they need to be supported, both in their health and in their parenting. So we have been part of a much bigger movement, if you like, to raise the profile of men's health. And we see our job as the Fatherhood Institute as making sure that fatherhood is a strand within that focus. I'm going to be talking a little bit in my presentation about the men's health strategy. And I'm hoping that some of the people in the room today will help us do a really good job of contributing to the consultation on the men's health strategy that is happening right now. All of this matters because father's health has a huge impact, not just on him, but on his children, his partner, and we would argue on the wider economy. So you may be aware of the ongoing campaign for better paternity leave, which we are part of. It feels to us like sorting out a farther pathway for better health services for men is key to run alongside that. Okay, so the first point to make is that fathers are there. So we know that 95% roughly of fathers are present at their children's birth. The percentages of fathers who come to antenatal scans and accompany their partners to other appointments in the antenatal period are very high, well over 90%, and they have been for quite some time. We know that roughly 90% of babies are registered to two parents, and in the vast majority of cases, those two parents are a mother and father. And so we know that dads are kind of in the room already, but all too often they're either ignored or they're kind of sidelined. When you look at surveys of fathers' experience of maternity services, for example, they often talk about very basic things like whether or not they were addressed by name, did anybody shake their hand, did anybody do really quite basic things to make them feel available? Is there a chair for him, for example? So I think even without getting into more complicated things, I think there are lots of quite simple things that we probably could be doing better as a service. So why should we care about this? Well, we know that babies who have positively involved fathers, who are confident as parents, who feel like they own their space as a parent, those babies go on to be better adjusted. Their cognitive outcomes are better, their social outcomes are better. And as a corollary of that, father's behavior and characteristics can also lead to negative outcomes. So things like if a father is obese, it's more likely that their child will be obese. There are lots of other kind of clinical outcomes that the father has impact over. And so we could and should be thinking of that father not just as a partner to the mother, although that's an important role in itself, but he does also bring along his own individual impacts. there's a bit of a plug on there for one of our reports, Bringing Baby Home, which covers it's an evidence review covering the first postnatal year. There is an equivalent and earlier report called Who's the Bloke in the Room, which covers the antenatal period. Both of these you'll find in the research section on our website. So where are these missed opportunities? Well, at the moment, there's no strong requirement for healthcare professionals to address fathers directly, to support their caregiving role, and to do anything to help fathers change their harmful behaviours where necessary. So things like smoking, their alcohol consumption, their eating, their attitudes towards exercise, all of those things. And there's good research evidence to show that those things really matter, both directly in terms of the father-child relationship, but also in terms of the indirect effects on the mother. So smoking, for example, if we want to cut down on mothers smoking, addressing the father's smoking is one of the key ways that we can do that. So that's number one. Number two, the information that we provide to parents tends to be predominantly mother-focused. There are obvious reasons for that, and I'm not here to say that addressing the mother and providing her with good information is not important. The point is that we ought to, all at the same time, be providing good information to the fathers too. Data systems. I'll talk about this a little bit more as we go through the presentation, but the information systems that our services are built around tend not to be very good at collecting and sharing data about fathers. And just to add here that this is not just about being nice to dads. This is also about designing a system that meets mothers where they want to be met. So we have overwhelming support from mothers for better paternity leave, for example, and also for fathers themselves as individual parents getting a good experience of health systems, because mothers understand that if that happens, it reduces the pressure on them as mothers and enables the family to function more effectively as a sharing enterprise. Okay, so our campaign has 4 key asks. The first is that the government should review NHS and other data systems so that fathers' details are routinely recorded and matched to their children's, because we know that that's key to successful father engagement. The second is we want all fathers to have the right to an NHS health check in the first 1,001 days, at least one. And that health check would cover some of the key issues I've been talking about. So if we think of that health check as covering everything that affects a man's ability to be a great dad, and also that addresses the health impacts that they have on their child and the mother. The third is training for health staff, midwives, health visitors, GPs, mental health practitioners, so that they feel confident at engaging with dads, and crucially, that they see men's fatherhood as a matter of routine. So is a GP, when a man walks through the door, is he seeing him as a potential father, and is he addressing his work towards that possibility? We know that in a lot of cases that's not happening, whereas it would with a woman of a certain age who walks through the door. Questions about motherhood are much more likely to spring to mind. And the last one is about the information that we provide fathers with. So we need to really get to grips with that, make sure that there is a kind of nationally agreed minimum, if you like, of information that every new father should receive. That's not to say it can't be localized, but we should be standardizing the requirements of that information. Okay, so what are we doing in our campaign? So we have an open letter to Wes Streeting, and I would urge you to have a look at our website and sign that, if at all possible. We are trying to identify and amplify information about the best practice. Kieran is in the room, and he's an example of this. So we want to kind of try and get as much information out there and get it in front of the right people about innovative and effective approaches. There's a need for better evaluation of some approaches, and we see it as our role as pushing for better evaluations and a stronger focus on evidence-based practice by local areas. Publishing evidence about father's impact. So some of this stuff is already on our website. We have other stuff planned. We have a practitioner survey, which, if you haven't already, again, I would urge you to share your experiences through that, and you'll find that on our website. And we are currently working on some guidance to give to fathers directly, and also some for practitioners, to hopefully get lots of people thinking and talking in the right way about fatherhood in the Men's Health Strategy consultation that is open now and runs until the middle of July. So we will be producing some stuff, hopefully end of this month or at the start of June, and you know, we'll do everything we can to share that with you. Okay, I don't think I've got time to look at this. This is basically some interim findings from the practitioner survey that I just mentioned. The numbers are small. I've got limited time, so I'm not going to go through these. I'm happy to share the slides afterwards if you do want to have a look at these. Really, the main call to action with the survey is for more people to fill it in. So if you're a practitioner, I would love it if you could do that. Fatherhood Champions. So we have a Fatherhood Champions training program. And these are some of the common things that we hear. So these are people who are doing a kind of intensive 3-day training course to become advocates for fatherhood in their local services. And so, yeah, one of the things we hear is can we do that? There's a lack of clarity about what is and what isn't possible. So sometimes that's about the culture of organizations and the commissioning of services. We need to get more confident, I would say, as a health system about this stuff. We need to start having high expectations of our engagement with fathers. Information sharing is absolutely central to this. So we know, for example, during the booking in appointments in maternity services, data will be collected about fathers. But once we get to health visitors, that information often is not being shared. The health visitor is there with a kind of blank page where the father ought to be. So we need to work out where that data is going, why it isn't being shared. Some of this is very complex. It involves banging heads together in local authorities, health systems, and so on. So there is no straightforward solution. But I guess what we are trying to do is to highlight this as an issue and feed it up to the people at the top. Because whilst it's complicated, it's not rocket science, and we need to find ways through this. Resources, I've already spoken about. There are lots of great resources out there, so I'm not here to say that there aren't. DadPad, for example, is out there and in lots of areas is being used very well. But it's very piecemeal, and there aren't enough minimum requirements for this for the best information to be made available. And assessment and evaluation, again, not enough is being done at a commissioning level to assess how good, bad, or indifferent we are at engaging with fathers. This is the kind of thing where champions can make a huge difference, because if you have champions, ideally a group of champions in a locality, they can be the ones who see the gaps and start to push for change. Okay. Just very quickly, these are some email addresses, which again, I can share the slides so that you have those if you want to connect directly with us. And that is a QR code for the Looking Out for Dad campaign page. And from there, you will also get to the open letter to Wes Streeting. And that is the end.
Thank you, Jeremy. That's a really helpful and insightful presentation, showcasing a lot of your work that you're doing to help dads. So thank you very much for that. It's just worth saying to people who may not know that the First 1001 Days movement has endorsed the letter to Wes Streeting, and some of our members have been circulating it through their communications channels. I've signed it personally myself, and would encourage you to do so as well. And I've just shared the link directly in the chat in case you didn't have a chance to catch the QR code whilst it was on the screen. So we'll move to take some questions for Jeremy now. There have been a couple that have come through, but if you still have some, do put them in using the Q&A function, and I'll read them out to Jeremy so that everyone can hear it. So the first question we've had is submitted anonymously, but it's: what opportunities to make change with the newish Labour government are there? How does fatherhood fit into their mission style of government?
Okay, good question. I mean, I think for me the biggest opportunity is Wes Streeting and the men's health strategy. That is big. It's a big achievement to have got a senior politician to make a stand on this, and it feels like quite a personal mission on his part. So we have a big window of opportunity to feed into the men's health strategy. As I say, that opportunity closes in mid-July. There is a fatherhood. There are opportunities to talk about fatherhood in there explicitly. So if you go into the survey, you'll see you can choose topics that you think the strategy should focus on, and one of those is fatherhood. And in the guidance that we'll be producing, we'll be kind of suggesting ways in which all of us can frame our answers to take account of fatherhood. So I think that's the big one. Aside from that, it's always the case that it's difficult to bring about change, and there are never massive pots of funding around, and certainly never earmarked for fathers and fatherhood. But I take it as a very good sign that fatherhood is at least named as a possible strand for the men's health strategy, and also that the health secretary is personally, he seems to be behind that strategy. So yeah, we'll have to see.
Thank you, Jeremy. The next question we've had it's a bit of a specific one around the data sharing issue. So it's, will the unique child identifier and the digital red book, should they come into effect, address the issues around data sharing, or is more required?
Oh, yes, very good question. So we are currently trying to find, and this we've been working on this for some time now, and the clock is ticking and we're running out of time. We are trying to find somebody in the House of Lords to table an amendment that would address this very issue with the single child identifier. Basically, we want a specification that father-child data linkage can be achieved, or at least piloted. And so, yeah, we've been reaching out to many peers of the realm, and unfortunately, nobody has yet bitten. But I mean, this is happening like over the next few days. I just hope we can get one. The reason that's really important is that if we can't get it into the legislation, we're going to continue to be in the situation of kind of, putting our hands up the whole time and saying, what about dad? What about dad? What about dad? And if there isn't something actually written in the form of legislation, the concern is that this issue will just continue to drift as it has done. We've tried 1,000,001 ways to get this to the top of the agenda. And yeah, so watch this space.
Thank you, Jeremy. Right, I'll take this last question because I'm aware of both your time and we've got Kieran to present. So the last question's from Martha Ripliss, the charity for premature and sick babies. And she asks, how do champions engage with fathers in the community?
Well, that depends on who they are. So the champions we have so far come from a wide range of professional backgrounds. Some are health visitors, some are people from family hubs, people in early help, social workers. So it kind of depends how they've come to us and what their focus is. Some also from kind of infant mental health backgrounds. So there isn't a one size fits all answer to that. And in a sense, that's the beauty, I think, of the champions model, is the more we can get whoever is commissioning our training, so whether that be a local authority or a family hub or whoever it is, the more we can get them to think creatively about, in our locality, who are the people who could advocate for father inclusion, where should they sit? And sometimes that might be really obvious because there's already somebody who kind of is an enthusiast. But sometimes if they're thinking strategically about it, they might want to go and do some preparatory work to get to a position of knowing who it ought to be in X service, Y service, and so on and so on. So yeah, that's how it works. Yeah, we're starting to see really good impact in some areas, especially where there is a group of champions across a locality and coming from different disciplines. That's when it feels like you've got the potential for magic to happen.
Okay, great. Well, thank you very much, Jeremy. Appreciate your presentation and taking the time to answer questions, especially as it was sort of you jumped into it through short notice this morning. So very much appreciate that and thank you.
It's a pleasure. Thanks very much. And enjoy the rest of the session and good luck, Kieran. I'm sorry I'm not going to get to see you.
Right. Yeah. So now I'll pass over to Kieran Anders from Dad's Matters. He's doing some great work over in Stockport. I'll let him tell you all about it. Kieran?
Thanks, Ben. And yeah, it's always nice to follow the Fatherhood Institute. They really bring home all of that data and knowledge that we use to deliver our service. So yeah, I love following them. It's not as easy to go on before them. I think it's much better when they do the scaffolding. I'm going to share my screen and then we can crack on. Hopefully that will be working really well. So I'm Kieran. I'm from Homestart. I'm currently the project lead at Homestart UK for the Dad Matters project. Today, I've been asked to talk about some of our outcomes. So things that we do that we know really work, some of the things we've learned in delivering our model. And particularly, we have an evaluation in Stockport that I'm going to share with people today. So the background to Dad Matters is that we came from Homestart Host, which is a home start in Greater Manchester, covering Oldham, Stockport and Tameside, and also Bolton. We just couldn't fit that into the acronym, so it became Host. And we started about 8 years ago, working alongside the Tameside Early Attachment Service with Dr. Pauline Lee and Karen Kilner, who were specialist health visitor and the lead consultant clinical psychologist, and the Anna Freud Centre, who did the evaluation on our pilot for the first year. We did all of that through a Health Foundation grant, which was the only non-clinical trial grant awarded that year. It really gave us a year to try lots and lots of different things. And after all of that work had been done to secure the grant, they employed me as a dad champion, which was probably the best job title I think I've ever had. And as a dad champion, my role was really to work in Tameside, to engage with dads, to find out what dads wanted in that first 1,001 days, what would help them with their situation, what things were they worried about, and really figure out what our model could look like within a home start family. So we started doing lots of consultation with dads. We saw around 200 dads in consultation, and That's where the brand came from. So Dad Matters is Home Start. We are Home Start, but the brand looks slightly different so that we can reach dads in places that we know dads are. And as Jeremy was saying before, dads are available. They are in the rooms that we need to be in. And so as a project, we go to those rooms. We attend antenatal clinics, antenatal classes, post-labor wards, neonatal units, mother and baby units, teenage pregnancy clinics, asylum seeker clinics, and all of the places that we know dads are available, birth registrations as well. Some of the things that we learned in that period was that we need to go to the dads. We talk a lot about how men don't reach out for support and that they need to reach out more to get support. But actually, if they're not reaching out, then we need to start reaching in. When we reach into dads and we ask them how they are, we ask them specific questions that we know are probably things they're going to be coming up against, like sleep and work and supporting their partner and mental health and parenting. We can ask them specific questions, really help them to acknowledge the things that maybe they're going through that they haven't thought about yet. But we need to go to them. We go to places where they're thinking about themselves as dads. So our project is built on the foundation that dads are dads, and that's the thing that links us. So we don't use other things to bring dads together. Things like music and football and dads stay and play groups, they're great for dads who attend those things and get a lot out of them. But for us, parent-infant relationships was definitely the thing we really wanted to concentrate on and help dads to understand what that is. We needed to start thinking about tailoring language, the branding, the technique that we use, the engagement that we have, really just tweaking things that we take for granted. Things like asking dads how they are rather than how they feel was a really great turning point in how the conversations would happen. How we suggest a referral into a service for a dad. If we say, we work with these, we'd like them to give you a call, that sounds much better than we work with this service who we want to refer you in for an intervention, because that sounds very formal and is much more likely to result in a refusal. We knew that we had to engage with dads, but also there's mums and professionals that really need to understand the role of dads, the unique perspective of dads, the transition that dads go through, because there's a lot of societal gatekeeping, unintentional, but we need to make sure that everybody is educated about what's going on for dads and their families. And if we keep the baby at the centre of the work that we do, dads are as important as mums where babies are concerned. And so if we're working towards the impact on babies and families, then we can absolutely justify the work that we do with dads in the short term, in the interventions, and obviously in the long term. So the key focuses of Dad Matters became these four on the screen. We are going to work in the first 1,001 critical days. They are the best place to engage with dads. Dads are more visible, they're more engaging, they want to know more, but also the impact on the child is going to be far greater. We want to do three things in that period. We want to support dads with attachment and bonding. That could be education around it, it could be information around it, or it could be one-to-one support. It could be supported interventions, it could be peer support. We also want to support with mental health, but where we differ there is we won't offer the interventions. We'll give dads the opportunity for peer support to acknowledge and explore their mental health and then to find the right intervention if that's appropriate. Often dads tell us that the peer support is enough, but those dads that need extra, we can support them into the pathways that we know that they can engage with that they often don't. We also want to support them to support their partner's mental health. A lot of dads come to us with the worries around their partner and how they communicate, how they ask questions, what the services around mums are going to be able to do. And so we try and support dads to link in with those services and understand that a little bit more too. And then the last thing we want to do is help them access services. There are lots and lots of services, interventions, clinical as well as third sector, where dads can get support, where we know the support will work, but dads don't often find their way to those places. So we want to help dads to find those out too. And so we signpost and refer into all the services that we know are useful and are safe and evidence-based for dads that we come across in our communities. So the way that we work is we have a few slightly different layers to the work. So universal engagement is the first bit. We see lots of dads there, and I'll tell you a bit about the numbers in a short while. The universal engagement is antenatal clinics in particular are a great place to see dads. We know that if we go to an antenatal clinic for a couple of hours, we can see between 15 and 30 dads. If we do that every day, we're seeing hundreds of dads in a week. We obviously can't be there all the time, so we provide resources like pull banners, flyers that are educational and informational rather than trying to get dads into what we do. We also deliver training and stuff for professionals, which I'll get onto in a sec. But that universal engagement also includes our social media and our website. And what you'll see there is that it's very much about sharing dads' journeys, sharing support services. It's really educational. It's about a touch point for dads. It's not about bringing dads to us. It's about helping dads to acknowledge where they're at so that they can find the right support. And it also includes things like we have a new dad workshop online that any dad in the UK can join by booking on through our website, where we talk about attachment bonding, mental health. We go to antenatal classes where we do a dad chat, which again is like the new dad workshop, but a bit shorter. We have a closed Facebook group, and we do visits in alongside antenatal clinics, post-labour wards, neonatal units, mother and baby units. And we've classed those as targeted outreach, as you can see in the next section, where there's extra parts of the situation that dads might need support with. We might work with teenage dads through family nurse partnerships or teenage pregnancy teams. We work alongside enhanced midwives for families in social care or families who may be asylum seekers. We'll work with mother and baby units for dads who are visiting mums who are inpatients. We work on neonatal units, lots of places like that. And again, it's all engagement. It's just speaking to dads, asking them how they are, giving them information, and talking about the baby as early as we can. If we speak about the baby, then the dads are more engaged. They want to know more about it, and they want to still carry on finding out more. The third thing we do is one-to-one referrals. Our coordinators, our paid workers, will take those referrals and hold the caseload. We usually see between 50 and 60 dads in a year in referral for one member of staff. That referral is dad-led. We measure impact using Core 10, which is a wellbeing questionnaire, a parent-infant questionnaire that we designed with our clinical lead, Pauline Lee, in Tameside, and sometimes things like goal-based outcomes. We also produce case studies and family journeys. And you can see some of our family journey videos on our YouTube channel, Dad Matters UK. They're quite hard hitting and they talk about things like suicide. So if you do go to watch them, please look after yourself. And those one-to-one referrals, again, are dad-led, they're open-ended. There's not usually a time limit to them. And it's really about helping the dad to bring the baby into perspective, whilst also trying to figure out what it is that they need to do for whatever situation they find themselves in. Referrals tend to come from professionals. So perinatal mental health, parent-infant services, social care, family hubs, early help, home start staff. We do get some self-referrals as well for dads that maybe have seen us and have realised that we are somewhere that they can get support from. So because those referrals tend to come from professionals, we also know we need to engage with professionals to help them understand and improve their practice. Because when midwives and health visitors and perinatal nurses are better at speaking to dads, they're more likely to refer the dads to us. And when they understand how to sell the referral, the dads are more likely to accept it when it comes from one of those professionals. And it makes the whole process much smoother and much more quality and actually much more successful in the long run. So we engage with professionals in things like team meetings, lunch and learns. We also deliver multi-agency training in our commissioned areas. And we support the IHV, Institute of Health Visiting, with delivering their father's payments training. Finally, dadvocacy. It's about advocating for dads. It's about sharing the stories and the case studies that we have of dads to make sure that people are aware of what things dads are experiencing, what are the challenges that dads are going through. So often in research and in campaigning, we hear from dads that are confident enough to come forward and say that. We see the dads that are not confident enough to do that, and we feel a responsibility to be advocates for those dads to share the experiences of 16 and 17-year-old dads with special educational needs, dads who are separated and having supervised contact, really dads that are in situations that we don't hear about in those campaigns that often. So in the last 7 years, so from 2017 to 2024, we now have 20 Home Start schemes that are delivering the Dad Matters project, with 32 Dad Matters coordinators across the network. In that 7-year period, we saw 19,499 dads in universal engagement. Bearing in mind that I was the only coordinator for 3 of those years, so that is back-ended. It's pretty weighted for the last 4 years, up to 2024. We supported 1,300 dads in one-to-one support. We have 44 Dad Matters volunteers who help us with the universal engagement, and we've engaged and trained 7,500 professionals. So that, again, is the 7 years up till 2024. Now I'm going to tell you about the last year. In the last year, we've got 30 plus home starts now delivering the Dad Matters scheme. We have 36 plus Dad Matters coordinators across the UK, well, England and Wales. We've seen over 13,000 dads in a year in universal settings. We've seen over 1,000 dads on top of that in neonatal units, 50 dads in rainbow clinics where they've experienced child loss and are now pregnant again, over 1,000 in perinatal mental health activities or events such as drop-ins at mother and baby units, specific perinatal mental health drop-ins, walk and talks and things of that nature. We've had 800 attendances at walk and talks, 700 dads in one-to-one support, over 10,000 individual contacts with those 700 dads. That's phone calls, text messages, meetups, home visits. We've had over 5,500 perinatal professionals trained and engaged with, 57 active volunteers, and over 300 volunteer hours in that year. Again, this is just the last year. So on to our Stockport evaluation. This is one of those 36 plus schemes that are running in the UK. We did it last year. It was funded through local authority in Stockport as part of their Family Hubs delivery as a pilot, and it was also they paid for an evaluation. So these are the targets, and as you can see, there's a lot of green ticks alongside it. We saw over 800 dads in universal settings in Stockport, worked with 62 referrals, I think it was. We deliver multi-agency training, we did specific training for certain teams, and you can see the list. There's lots and lots of things there. You can go and see this on our website. The whole evaluation is there. I'm just about to post the link onto the website, onto the chat, so you can come and see that properly. You can download the PDF and you can see the summary of it as well. So all of this came in under £50,000. That included full-time salary costs, all the training, resources, management costs and expenses that we needed to deliver this program in that area. So for under £50,000, we've been able to see almost 1,000 dads with engagement, with universal support, with one-to-one support, and then all of those professionals as well that have been trained. So that is everything I wanted to share with you today. It's a whistle-stop tour of what we do. I'm happy to take questions. I'm happy to share experiences and case studies if anybody would like any. Please do go and check out the evaluation. And if you need anything, if you want to be connected to your local Dad Matters, if you have one, if you don't have one and you're considering getting one and you want to think about funding it or linking to funders, then we can help you to find your local home starter who can do that. Thank you very much, Ben.
Well, thank you, Kieran, for a very interesting presentation. It's great to hear about the success you're having engaging dads over there in Stockport. So yeah, if you do have questions for Kieran, please send them in using the Q&A function. We've had 2 that have come in already, so I'll start with those. So the first one, Kieran, is if you could ask NHS trusts to implement one change to make things better for dads, what change would that be?
There's a few more than one that are all linked, I think. So what I would say is the first one, and Jeremy alluded to it earlier. Well, he didn't allude to it. He said it very clearly, actually. The data that we collect on dads is really important and it's really scarce. The data needs to be linked to the babies because when the baby's at the centre, then dads are important. So being able to link dads to their babies from the very earliest point is really, really important. And we need to navigate that. We need to figure out what that looks like because it's really, really difficult at the moment. Midwives who collect all that data in the first place, they're led by mums, and if mums don't want dads to be there, or dads aren't there because they're working or whatever the situation might be, then dads are missed. And actually, that's 50% of the child's experiences in the first 2 years. We need to make sure that we're able to know who dad is so that they're not invisible in those services. So absolutely collecting that data, and that's linked then to capturing data that we can use to evidence the need for rollout. So the evidence of suicide attempts for dads with children under 2, or suicide completion for dads with children under 2 is scarce. It's really hard to find that data. But if we had it, we could then use that for commissioners to influence their suicide prevention funding and target more dads in the early years. We also need to understand situations of families more. So as a co-parent, our dad's separate. Are there anything that we can figure out in terms of what their situation looks like independently? And then finally, and it's not necessarily the NHS, this is probably more policy, but the way that things like benefits are distributed to parents means that dads miss out on having time with their children. So not being able to claim housing benefit because the children don't live with them, not being able to claim child tax credits or childcare vouchers or childcare support is a detriment to dad's relationships with their babies. So there needs to be some research into what that looks like and how that can be supported and equalised without taking away from mums, crucially. So we need to figure that out. There needs to be some research into that. Thanks, Ben.
Great way of pulling three answers in when you asked for one. Well done. They were all nicely linked together. Right. The next question, again, it's from an anonymous attendee, but it's what plans, if any, are there to roll out more widely in the UK?
So currently, Homestart Host and Homestart UK are working together to embed the Dad Matters model into Homestart UK so that it will be available for homestarts across the country at some point. So we have a 6-month window to do that transition, and we're currently in the middle of that. Well, we're right at the beginning of that. So we're not sure what it will look like or how it will develop over the next few months. But the ambition is that it will be available. We have scaled it from one Homestart in Tameside to covering 36 geographical areas in the UK. So we know it can be done. The model works. We're kind of really finalising what that looks like. And we can share it with other home starts right now. So we would be ambitious to try to do that. And we definitely need to try and end that postcode lottery of access to support. And there needs to be some guidelines set of what dad's peer support or dad's perinatal support intervention looks like. What are we providing in that? Is it because at the moment it's really is a free-for-all. Some services are providing a dad's stay and play, and some are providing one-to-one clinical therapy. Some are providing counselling services. So there's a whole load of different kind of standards that we can really standardise across services.
Okay. Thank you. And we've just had another question come through, which I'll take as the last question given the time. And do you think female professionals find it harder to engage with dads?
Absolutely not. No, it's a shame Jeremy's not here. The Fatherhood Institute has some research into delivering interventions, and we know that the gender of the person delivering the intervention does not affect the success of the intervention. So women working with men is absolutely fine. It works really well in that with those interventions. I think where the gaps in research are is in the engagement of dads. What we found is we have a brand that engages dads. So when we have female coordinators, they're perfectly able to use our brand as the way in, as the way to engage with those dads, and it's perfectly successful. We nearly all have beards in the service, but obviously the female coordinators don't have beards, and we all look a bit like the logo here, but some of that is about lived experience, and mums have lived experience too. Mums have lived experience of supporting partners, of seeing their partners as dads, and also of challenges that dads might come across. So in peer support, we've not found it too difficult, but it is all about how you set up the initial engagement. How are we reaching dads? If your service looks like it's for mums and you have females delivering it, then maybe the dads will stand away from it and not realize that it's good for them. So it's about how do we promote that within that service. But absolutely, female coordinators are really able to do this.
Okay, well, thank you, Kieran. We really appreciate you taking the time to talk to us and to share your great work. And thank you for all of you that have joined this lunchtime webinar, for taking the time out of your day and hopefully you've taken a few great nuggets of information away that you can use in your work. Please do remember to explore the details of Infant Mental Health Awareness Week. Again, I shared the link in the chat earlier. It's parentinfantfoundation.org.uk/IMHAW. And if you would like to feature, as Jeremy and Kieran have, in one of our future lunchtime webinars, please do let me know. My email is ben@parentinfantfoundation.org.uk. So thank you very much for joining us. Enjoy the rest of your day.